An East Texas trauma surgeon who has worked in mass casualty situations is giving us an insight into how medical personnel are handling that shooting in Las Vegas. Today, he spoke with our Paul Rivera about the steps that are taken during and after a mass shooting.
In a mass casualty situation,
what we call Trauma 1. This is our main trauma unit.
Trauma surgeons like ETMC's Gale have to move quickly to help hospitals that are inundated.
I was able to communicate with a friend of mine who was a trauma surgeon in Las Vegas, and he indicated that they received 104 patients within just a few minutes.
The challenge once victims are brought to the hospital is figuring out which injuries need the most attention.
Segregating the patients into who we can save and who doesn't need treatment right this minute because they're not as sick. A challenge just to identify the injuries, and you often don't know until you can go to surgery.
Could you put yourself there? Could you even imagine what they're going through down there?
I can imagine it, although I don't think that anyone's training prepares them for that sort of thing. It's doing the best you can with the resources you have.
A tough situation to deal with.
They look like war zones. I've seen a few pictures from some of the hospitals there. There are patients everywhere, and the staff themselves are traumatized, in addition to the unfortunate victims.
But one they must be ready for to help those patients recover. Paul Rivera, KLTV-7 News.
Gale said that recovery for the victims may range from a few days to a month and maybe more as they rehab from their injuries.